Minutes of live stream. Let's just grab a brain scan so you guys can have some fun checking out a brain MRI. So this is contrast enhanced. This is a 69-year-old male. I'm downloading the images. It says he has, what is it? He has a stroke. He has had a stroke sometime in the past. Nobody says when, but he is unable to walk and has some kind of tremor in his upper extremity. So it seems like he has had some stroke, not just a single place was hit. So this is a Sagittal T1, no fat saturation, shaky, all filled up with artifacts. There is clear signs of atrophy. Let's go for a T2, axial T2, no fat saturation, clear sign of brain atrophy. I can see lacunar insults, lacunar strokes all over the basal ganglia. Major white matter disease, microvascular disease, moderate hydrocephalus. There is also multiple ischemic lesions on the cerebellum, the bones, the cerebral pedicles, the thalamus. This is a chronic microvascular patient. This is one of those cases of dementia related to microvascular disease for sure. Yep. Look at that. And that. This is a FLAIR.
Tudo bem, pai?
Oi, amor.
Não tô bem?
Não. Sério.
Por quê?
Porque eu não sei, amorzinho. Não tô acostumado com aquela cama. Deixa eu terminar aqui que eu tô em live, tá? Let's go. FLAIR says as much as T2 says. I guess this could be some sign of brain bleed, old brain bleed. This is an SWI sequence, a susceptibility weighted imaging sequence. Yes, there is some blood deposits right there. So this is probably a scar of a hemorrhagic, a bleeding event, quite common. Small sites of previous microhemorrhages right there on the cerebellum as well. So this is a chronic hypertensive patient with diffuse and severe microvascular disease and all its possible presentations on MRI. It makes total sense for this patient to have multiple disorders related to these many strokes, previous strokes. So all you have to do now is gather all this information in a very quick, objective, and easy to understand manner and put it all in our report. Contrast enhancement makes no difference in this case because this isn't necessary. In T1 we can see how bad those lacunar, those small stroke sites are all over the parenchyma. It's pretty bad right there, and on the bones, mesencephalus, and all over the place. Also the cerebellar parenchyma has been hit with such events right there. blood products show up as low signal intensity on the SWI sequence. So I have a template for such cases, of course. We need to see the size. We have to do a visual assessment of the size of the hippocampus. See, hippocampus are of perfect size. They are the dentate gyrus is just perfect. Although this isn't properly scanned, but no, there isn't a single sign of hippocampus atrophy. So this isn't Alzheimer's disease. This is microvascular, severe microvascular disease, which leads to vascular dementia, usually related to diabetes and hypertension.